Step 1. The female patient is given a drug to suppress the natural menstrual cycle. It is given in the form of either injection, which the patient gives to herself, or as a nasal spray. This is done for 2 weeks. Step 2. When the natural menstrual cycle is suppressed, the patient is given a fertility hormone called FSH, follicle-stimulating hormone. This is taken as a daily injection for the roughly 10 to 12 days, depending on the patient's response. FSH increases the number of eggs produced by the ovaries. This means there are more eggs that can be fertilised, therefore a greater choice of embryos that can be used in the treatment. Step 3. To monitor the progress of the treatment, vaginal ultrasounds or blood tests are performed. 34 to 38 hours before the eggs are collected, a final injection is given to mature the eggs. Step 4. The eggs are collected, under sedation and ultrasound guidance, by a needle being inserted through the vagina and into each ovary. The eggs are then collected through the needle. At the same time, sperm is collected from the male patient. The sperm is then washed and spun at high speeds for selection purposes. Step 5. The eggs are mixed with the sperm from the patient's partner or sperm donor in the laboratory for 16 to 20 hours. If the sperm is too few or too weak, they are injected into the egg individually in a process called intracytoplasmic sperm injection. After this time, the eggs are then checked for fertilisation. 3 fertilised embryos are grown for a further 1 to 5 days in the laboratory. The best embryo, or 2 embryos, will be chosen for transfer. After the eggs are collected, the female patient is given medication to prepare the womb lining for the embryo transfer, given in the form of an injection, gel, or pessary. Step 6. If the female patient is below the age of 40, a maximum of 2 eggs are used. If over 40, a maximum of 3 eggs are used. These restrictions are due to the risk of multiple births. The remaining embryos can be frozen for future IVF treatments.
Little device through the neck of the womb, a bit like having a smear, and take a small sample. So it is straightforward, painless.
It aims to help couples where the woman is carrying a genetic disorder from a healthy female donor to create an embryo and in time a baby which will contain DNA from all 3 adults, hence the 3-parent label. The technique involves using 2 fertilised eggs, one from the mother and one from the donor. The nucleus of the embryo, the bit that contains the vast majority of our genes, is removed from both eggs and the donor's is discarded. The nucleus of the parent's embryo is inserted into the donor embryo, which has healthy mitochondria, and then implanted into the mother's womb.